wondered, how can we learn from history to provide better care today? Well, stick around because today I'm diving into the Tuskegee Syphilis study and sharing 5 invaluable tips to become more vigorous advocates of equitable care. But before we get into that, stay tuned until the end because I've got a bonus tip that will be a game changer. Hi, I'm Tamisha Campbell, the founder of Enhanced Black Women's Health, and my mission is to equip healthcare providers like you with the knowledge and tools to address the unique challenges that Black women face in their pursuit of equitable healthcare. And unfortunately, the infamous Tuskegee Syphilis study taught us all too well what can happen when we don't address the disparities that persist in healthcare delivery. From 1932 to 1972, the Tuskegee study was a chilling testament to the egregious harm that can arise from a lack of advocacy and oversight in healthcare. In this study, 600 impoverished Black men were recruited with the promise of free medical care. Tragically, they were deceived and denied proper treatment for their syphilis, even after effective antibiotics became available. The study's enduring legacy is a stark reminder that vigilance and advocacy are paramount in ensuring that no individual, regardless of race or socioeconomic status, falls through the cracks of our healthcare system. And as we know, Black women are increasingly falling through the cracks with the disproportionate burden they are experiencing of chronic conditions. I firmly believe that by understanding the lessons this dark chapter of medical history holds, we can equip ourselves to serve our clients better and ensure that they receive the care they deserve. Now, here's a question for you. How do you think historical events like the Tuskegee Syphilis study still impact healthcare today? Share your thoughts in the comments below. And remember to join my free Substack community where I empower you with weekly actionable tips to ensure every Black woman receives the care she deserves. Now, let's jump into those 5 tips. Number 1, educate yourself on cultural competency and sensitivity. Understanding the cultural nuances of Black women's experiences is critical. For example, familiarize yourself with the historical trauma they may carry and always approach each client with empathy and respect. 2, make informed consent and transparency a priority. Learn from the mistakes of the past. The Tuskegee study painfully showed us the consequences of withholding information. Prioritize informed consent, ensuring your clients fully understand their diagnosis and treatment options. 3, advocate for regular screenings and preventative care. Black women face unique health challenges. Encourage them and empower them to take charge of their health through education and accessible resources. For instance, schedule regular screenings for conditions that disproportionately affect them. 4, challenge racial disparities in healthcare. Support initiatives that actively combat biases and promote diversity in healthcare leadership. Get involved with organizations working towards these causes. And by advocating for change, we contribute to a more inclusive and equitable healthcare system. And 5, collaborate and network with other advocates. Strength in numbers. So join forces with community organizations, advocacy groups, and fellow healthcare providers. And together we can bridge gaps in healthcare access and delivery. So there you have it. 5 powerful ways to become better advocates of equitable care. Educate yourself on cultural competency and sensitivity. Make informed consent and transparency a priority. Advocate for regular screenings and preventative care. Challenge racial disparities in healthcare, and collaborate and network with other advocates. Now for that bonus tip. Prioritize health equity training. Invest in ongoing health equity training for yourself and your team. This specialized training provides the knowledge and skills needed to navigate and address the unique challenges faced by marginalized communities. It equips you with the tools to provide more inclusive and culturally sensitive care. Ultimately, that will contribute to a more equitable healthcare system. And by continually enhancing your understanding of health disparities and learning to implement best practices, you're taking a proactive step toward ensuring that every client, regardless of their background, receives the highest standard of care. Thank you so much for joining me today. If you found this information valuable, remember, Like, share, and subscribe, and let's work together to create a healthcare system that truly serves everyone.
Subscribe and hit the notification bell to stay up to date on our latest videos, and together we can enhance Black women's health and create a better future for us all. Enhance Black women's health. Subscribe now.